The Rebel Alliance was making their presence felt, and so Sutter brought up an executive who initially was going to spend a week, ended up spending 4 hours. We wanted her to stay longer, but... So, during my medical staff meetings, I'm the chief of staff, so I hold the meetings, and we were speaking about an aspect of Obamacare called accountable care organizations. And here's the question I asked this Sutter executive. She's called Vice President of Medical Affairs. I said, does Sutter Health have any relationship with an ACO? And the answer was, no. And I said, really? Because I've been doing some research, and I found an ACO by the name of Brown and Toland. In fact, Brown and Toland was given an ACO license over Sutter. Sutter's application apparently wasn't approved. And Brown and Toland is one of those that can offer the capitated products. So when I brought up the word Brown and Toland, she said that, yeah, we're somehow related, but they're not up and running. The next day, I called Brown and Toland, and I said, do you have an affiliation with Sutter? And they said, of course we do. We have 2 separate ACOs. The one that's been in place the longest has been going for 1.5 years. So here are the actual meeting minutes. In the ensuing question and answer period, the issue of accountable care organizations was brought up. Dr. Breyer stated that Sutter does not have an ACO. When she was asked specifically about Brown and Toland, she said it is designated as an ACO and is affiliated with Sutter, but is not functioning at this time. One of the 30 right here. She went on to say, she was up to tell us that all our concerns were invalid. So one of the concerns we had is that if we transfer ownership, all of the authority over medical staff responsibilities go to the regional board. They have ultimate authority. It's very clear in the regional bylaws. We read them. And that includes credentialing. So that includes who gets to be a doctor at the hospital or who doesn't. So it says, with respect to credentialing, Dr. Breyer stated that all of the chiefs of staff have a vote on the credentialing committee. Not true. There are 11 chiefs of staff. 1 of the 11 gets to the board and may or may not be on the credentialing committee. See, I'm chief of staff, so she's basically saying, well, you're going to have a vote on the credentialing committee. Not true. Absolutely not true. Dr. Breyer also mentioned that the chiefs of staff are on the quality and safety committee. Not true. So we brought that up and said, it looks like our read of the bylaws that isn't the case. What you're saying isn't true. At that point, Dr. Breyer said she had not read the regional bylaws. And our jaws dropped. We said, you were brought up here to quell the concern among the medical staff, and you haven't even read your own bylaws? I mean, she's in the region. She's a salaried executive of Sutter Health. The next day after the meeting, she made a trip down to the medical staff office and took a black pen and tried to delete that statement. Obviously, it went back in. But, I mean, does that give you a sense of what we're dealing with here? She comes to my meeting, makes a statement, and takes a pen and tries to erase it from the record during the most critical time for hospital care in this region that we've ever seen. The medical staff secretary said, I don't think Dr. Duncan's going to want you to do that. She was right. I want to just read, here's another Dr. Breyer comment. So this gets to kind of your point about, you try to talk to him. Dr. Breyer mentioned that Sutter owns our local hospital and could regionalize at any time. If they owned our hospital, they wouldn't be trying to transfer ownership of our hospital into their hospital. Even the regional president, who's her boss, said, we own the hospital. But they come up and make these statements, and unless you spend multiple weekends and holidays ferreting out the truth, they get away with it. I mean, it's as incredulous as this is. I mean, I think it's happened at some level, probably in all 27 other hospitals, but unless you make the effort and research what they say, they get away with it. I want to read just one more thing. And this is a doctor who worked both here and at Sutter Lakeside. I'm going to leave his name out just because I didn't ask him permission. So it says Dr. Jones, I'll call him, who's a hospitalist both at Sutter Lakeside and Sutter Coast, outlined several major problems with access to care at Sutter Lakeside under the Critical Access Program, including frequent patient transfers to other facilities, a large financial cost to the county, a large personal financial cost to the patient who is responsible for the air ambulance charges. He also stated that critical access would double or triple the number of patients being flown out of here. Surgeries would be canceled, and it would be hard to get new doctors here. This is the final line. It would be a potential death knell to medical staff quality and expense to this community. That's a powerful statement. I read it to the board. Didn't do any good. So at this point, there's just no way I am going to possibly get, I'm going to have to come back. I have so many notes on Obamacare. I did a lot of studying, but I'm going to, I want to get a few comments from Dr. Caldwell, who has been incredibly supportive, and his credentials with respect to care of this community, both as a physician and as a community member and a leader on multiple foundations, is truly remarkable. So I'm going to turn the microphone over to Dr. Caldwell.
Can I ask you one question first?
Yeah, I'll be back to you.
No, if this critical care goes in effect, how does it affect people up in the 70s and 80s? Is this, I mean, we're just too old to be treated with the best care?
Well, the fact is, yeah, the fact is, elderly patients and poor patients are going to feel this the hardest. I mean, it's really less of a problem for us. It could affect anybody. I mean, a 5-year-old kid could have a ruptured appendix tonight and need to go have emergency surgery, but in terms of numbers, it's certainly more likely to affect retired, aged patients more than others, but it really affects everybody. I mean, you just don't know what could happen in terms of your health, and we live in a very tenuous geographical location, so that's why, you know, we're seeing and thankful that other people are seeing the impact. Okay, Scott?
I'm missing something here. If they're trying to transfer the ownership, and its assessed value is something like $37 million, shouldn't there be a payment to the community or to the hospital district or something?
Well, right. I mean, this was Kevin's first question was, what are we getting in return? We lose all authority over all decisions forever in the hospital, and all decisions regarding the medical staff at the hospital for nothing in return. And maybe Kevin can help me. I mean, he's the one who would have made that argument back in 2011, so I'll transfer it to Kevin. Thank you.